Hi, Sherry Berger.
Good to see you,
Nice
Sherry.
to see you.
Mike, good to see you, Mike. Tom, good to see you.
Fremont.
Hi, so nice to see you.
Send your
How are
SMS.
you?
Stephen,
Pleasure to see you. Hi, pleasure to see you.
Thank you, Pastor.
Thank you.
John Bird.
John? Hey, guys.
Michael, Mr. Treasurer.
Nice to see you, sir. Steve, nice to see you. So nice to see you. Thank you. Good to see you, Barbara. Very nice to see you. Hey, Tracy. Good to see you. Ed?
Better do a bump recently.
Good move, man. How are you? Nice to see you. Thank you. All right, everybody, please have a seat. Carolyn, so nice to see you.
Charlie Hill.
Charlotte, nice to meet you.
Brian Frisley.
Brian, let me come on this way, so I'm knocking over the plans. All right, what's your name?
Colleen Kraft.
Hi, Colleen.
Nice to meet you.
Ira Harper.
Ira.
Susan Grant.
Susan,
Bryce Gartland.
very nice to meet you.
Marshall Lyon.
Very nice to meet you.
Nancy Fenster.
So nice to see you, Nancy.
Jay Bark.
Jay,
Crystal Jones.
Crystal, good to see you.
Jerry Lewis.
Jerry, good to see you.
Robin Brown.
Good to see you. And I'm
See
Barack
you.
Obama. Where am I sitting? Right here. Lost a little weight, but otherwise seem pretty happy. So
Thank you, Paul.
I think the main purpose of
Thank you,
me
Paul.
being here now is
Thank you,
just
guys.
to say thank you for the records. I mean, these are, I just received a general briefing, and
guys.
obviously we have to do everything we can to deal with this epidemic at the source. And Good afternoon, everybody. Please be seated. I want to thank Dr. Frieden and everybody here at the Center for Disease Control for welcoming me here today. Tom and his team just gave me an update on the Ebola outbreak in West Africa. Our efforts to help mobilize the international community to fight it, and the steps that we're taking to keep people here at home safe. Tom and his team are doing outstanding work between the specialists they have on the ground in West Africa and here at headquarters. They've got hundreds of professionals who are working tirelessly on this issue. This is the largest international response in the history of the CDC. After this, I'll be meeting with some of these men and women, including some who recently returned from the front lines of the outbreak, and they represent public service at its very best. And so I just want them to know how much the American people appreciate them. Many of them are serving far away from home, away from their families. They are doing heroic work and serving in some unbelievably challenging conditions, working through exhaustion day and night, and many have volunteered to go back. So we are very, very proud of them. Their work and our efforts across the government is an example of what happens when America leads in confronting some major global challenges. Faced with this outbreak, the world is looking to us, the United States, and it's a responsibility that we embrace. We're prepared to take leadership on this, to provide the kinds of capabilities that only America has, and to mobilize the world in ways that only America can do. That's what we're doing as we speak. First and foremost, I want the American people to know that our experts here at the CDC and across our government agree that the chances of an Ebola outbreak here in the United States are extremely low. We've been taking the necessary precautions, including working with countries in West Africa to increase screening at airports so that someone with the virus doesn't get on a plane for the United States. In the unlikely event that someone with Ebola does reach our shores, we've taken new measures so that we're prepared here at home. We're working to help flight crews identify people who are sick, and more labs across our country now have the capacity to quickly test for the virus. We're working with hospitals to make sure that they are prepared and to ensure that our doctors, our nurses, and our medical staff are trained, are ready, and are able to deal with a possible case safely. And here I've got to commend everybody at Emory University Hospital. I just had the opportunity to meet with Doctors Gartland and Bridner and members of their team, the nurses who, sorry doctors, but haven't been in hospitals, I know they're the ones really doing the work. And I had a chance to thank them for their extraordinary efforts in helping to provide care for the first Americans who recently contracted the disease in Africa. The first 2 of those patients were released last month and continue to improve. And it's a reminder for the American people that should any cases appear in the United States, we have world-class facilities and professionals ready to respond, and we have effective surveillance mechanisms. Sierra Leone and in Guinea. Tom and others recently returned from the region, and the scenes that they described are just horrific. More than 2,400 men, women, and children are known to have died, and we strongly suspect that the actual death toll is higher than that. Hospitals, clinics, and the few treatment centers that do exist have been completely overwhelmed. An already very weak public health system is near collapse in these countries. Patients are being turned away, and people are literally dying in the streets. But here's the hard truth. And if the outbreak is not stopped now, we could be looking at hundreds of thousands of people infected, with profound political and economic and security implications for all of us. So this is an epidemic that is not just a threat to regional security, it's a potential threat to global security. If these countries break down, if their economies break down, if people panic, that has profound effects on all of us, even if we are not directly contracting the disease. And that's why 2 months ago, I directed my team to make this a commander of our Army forces in Africa. He just arrived today and is now on the ground in Liberia. And our forces are going to bring their expertise in command and control, in logistics, in engineering. And our Department of Defense is better at that. Our armed services is better at that than any organization on earth. We're going to create an air bridge to get health workers and medical supplies into West Africa faster. We're going to establish a staging area in Senegal to help distribute personnel and aid on the ground more quickly. We are going to create a new training site to train thousands of health workers so they can effectively and safely care for more patients. Personnel from the U.S. Public Health Service will deploy to the new field hospitals that we're setting up in Liberia. And USAID will join with international partners and local communities in a community care campaign to distribute all our efforts. The safety of our personnel will remain a top priority. Meanwhile, our scientists continue their urgent research in the hope of finding new treatments and perhaps vaccines. Today I'm calling on Congress to approve the funding that we've requested so that we can carry on with all these critical efforts. Today the United States is doing even more, but this is a global threat and it demands a truly global response. International organizations just have to move faster than they have up until this point. More nations need to contribute experienced personnel, supplies, and funding that's needed, and they need to deliver on what they pledge quickly. Charities and individual the world still has an opportunity to save countless lives. Right now, the world has the responsibility to act, to step up, and to do more. The United States of America intends to do more. We are going to keep leading in this effort. We're going to do our part, and we're going to continue to make sure that the world understands the need for them to step alongside us as well in order for us to not just save the lives of families like the one I just discussed, but ultimately to make sure that this doesn't have the kinds of spillover effects that become even more difficult to control.